I'm Dr. Robert Wachter, and I'm professor and chair of the Department of Medicine at the University of California, San Francisco. And I'm also author of a new book called Giant Leap, How AI is Transforming Healthcare and What That Means for Our Future. Yeah, I think the first point is that AI is going to change the practice. I think this is really ready for prime time, and it's going to happen relatively quickly, I think, over the next several years. The first is kind of training wheels, is to begin using AI to handle routine administrative tasks. We're already seeing that. Where I work at UCSF, every doctor now has access to an AI scribe, meaning if you were a patient, we were chatting, my note would appear automatically, formatted in exactly the right way. And that would have taken me 3 to 5 minutes in the old days. And you would have noticed when we were chatting, I was sitting there typing. That's all gone. So we're beginning with kind of relatively small but important administrative tasks, creating a note, summarizing an old chart. 1 out of 5 patients has a chart longer than Moby Dick. And the idea that I'm going to be able to review 300 pages and summarize it in 2 minutes is impossible. Those sort of things, I think, are happening on the administrative side. In the U.S., particularly billing and coding, which is a pretty onerous task, is being done increasingly by AI. So I think it's smart to start with the easy stuff because you don't want to screw up in the early days. You want to gain trust and buy-in. The next step, I think, is harder, but ultimately more important. AI will begin, and is really already beginning, to suggest diagnoses. And I find I use it all the time. If you're my patient and we're talking, I may then go into a tool like GPT-5, or I may use a medical-specific tool like Open Evidence and put in, this is a 32-year-old man who comes in with chest pain, fever, shortness of breath, and has a creatinine of so-and-so. What do you think is going on? Gives pretty accurate answers, and it will get more and more accurate over time, particularly as those tools get integrated into the electronic health record. So I won't have to tell it all these things about you. It will know that because it will have read the record. So moving into diagnosis and then ultimately decision support is going to be the next big step. And finally, in fields like cardiology, but really in all of medicine, this thing called precision medicine has been around the corner for about 20 years. And what precision medicine means is you have high blood pressure right now. I treat you with a certain medicine, and it doesn't matter how old you are or what other diseases you have or what your other cardiac risks are or what your genes are. But AI is going to help us realize the promise of precision medicine. We will begin now knowing that for you, drug C is going to work better than drug D, or maybe for you, even though your blood pressure is a little bit elevated, we don't need to treat it because the rest of your genes and your environmental exposure tell us you have really no significant risk. AI is going to help us figure those things out, and also AI is going to help us do them. Because in my diminishing brain cells at my age, I can remember I treat blood pressure with this drug, but if you have diabetes, I'll use that drug. There's no way I can remember that I treat blood pressure in you with your gene pattern in a certain way. I'm going to require AI to figure that out, know that about you, and help recommend the right drug. So I think those are the 3 areas, sort of administrative tasks, relatively small but important clinical tasks, moving on to diagnosis and treatment recommendations, and ultimately moving on to precision medicine. I think it's very exciting.